it's that time! It's that time again, and I'm not talking about your B-Day. I'm talking about your V-Day. Your annual exam at the gyno. It's like a B-Day for your box, except the only person showing up is your doctor. The only gift they're given is a pap smear. What's up, ladies? I'm Madge the Vag, and today we're finding out how to get the most out of your annual exam. Hi, Dr. Poyner. Thanks for coming in.
Thank you for having me.
Why the annual? Why so much? Do you really need to see me every year? I mean, what could possibly change in such a short time?
So that annual exam allows us to not only evaluate health habits, but also allows us to evaluate ongoing signs and symptoms to determine if they have any significance.
So how do I prepare for my annual? What do I do before I come on in?
No intercourse about 24 hours beforehand.
Now, can I come in during my period? Is that okay?
Should defer if you're doing a pap smear. We see women during their period if they're having a problem, obviously with heavy bleeding or problems. But for the pap smear, again, we don't want anything, we don't want any blood to obscure the pap smear.
The weigh-in. I hate the weigh-in. Why do you need to know how much I weigh? I'm not a boxer.
If you gained weight but you don't really feel it, maybe your thyroid is off, it allows us to look at some other things and also to make sure that you're of a healthy weight.
I always get embarrassed when they ask about how sexually active I am. I don't want to say if I'm inactive or proactive or biactive. That's my business.
If you are sexually active, we do need to talk about sexually transmitted diseases if you're not in a monogamous relationship. So it keys into what we need to talk about also, or birth control. If you're still of reproductive age, we need to review, appropriate birth control methods.
When it comes to pap smears, what the heck are you even looking for?
So we're not looking for cancerous changes, but we're looking for precancerous changes. So when we're doing a pap smear now, many times, if you're over the age of 30, we're doing a HPV test along with it. If you're less than the age of 30, you may or may not be getting an HPV test.
What about like the STDs and stuff? Is that in your pap, or is that something I have to ask for?
If you are sexually active, not in a monogamous relationship, you should be doing a gonorrhea and a chlamydia screen each year, actually.
You really need a rectal exam?
You should have a rectal exam because there is something called anal cancer. It is out there, and it's one of the common places that HPV from the vulva, vagina, and cervix travel into the perianal area. So certainly over the age of 40, a rectal exam should always be considered.
So when you're in the front door, what exactly are you feeling around for? What are you looking for?
We try to feel the uterus or palpate the uterus between our two hands, and that's how we can determine the size of the uterus, the texture of the uterus, to see if there's any fibroids there, to see if there's any mass there, uterus, tubes, and ovaries.
Question 909. Will my bush go bald on its own like my hubby's head?
It's really important to have questions, write them down, use your time efficiently. But if you have more, call back, get them answered, make another appointment, because you know your body better than your doctors know your body. So you always want to make sure that you listen to your body.
So what are some red flags that I absolutely have to talk to you about?
Things that I always want to hear about immediately, if there's any type of unexplained pelvic pain, any unusual discharge, any abnormal bleeding, or not just feeling right down there, I always want to hear about that.
I feel prepared and ready now.
Excellent. Now you only have 855 questions.
That's progress, I think. Well, who knew? The annual checkup was a piece of cake. So don't forget to make your appointments and treat yourself. Going to the gyno may not be a party, but a healthy vag is a happy vag. If you have any questions or comments, put them in my box. My inbox, that is. To What's Up, I'm Madge the Vag. Thanks for watching. If you like this video, click to watch more, and don't forget to subscribe.